Hello, and thank you for joining us today. I'm Shayna LaFleur, and I'm coming to you from Madison College School of Professional Development and Continuing Education. I have with me here today Mike Baldwin, who is also from the School of Professional Development, and also the co-program directors, Amy Whitcomb and Kathy Spahn, who are the program directors for the Business Technology program here at the college. And we're going to talk to you a little bit about our grant-funded healthcare office certificate for incumbent workers. We're very excited about this program, especially with what's going on in the world today and the high needs that we have for medical positions. And we're going to be chatting a little bit about what the program is about, how you can be involved in it, what the grant funding does for you to help offset the costs, and just a little bit about the schedule, and of course, what the outcomes are. So with that, I'll hand it over to Mike, who's going to be facilitating the interview today.
Thanks, Shayna. This is a great opportunity for us to really hear from the subject matter experts in this opportunity. And as Shayna said, we've got programming here that I think is going to be really exciting for a lot of folks. So this will be a great opportunity for everyone to really just share in what it is, and again, hear from the folks that are going to be driving this program for us. So great to have Amy and Kathy with us, so welcome. Just want to throw a few questions at you, and the biggest and the first one is truly with the whole healthcare office certificate. So what skills, I'm a potential participant, what skills am I going to be gaining from my participation in these courses?
Hey, Mike. Hi, everyone out there. Great to have you join us today. The medical field, as we all know, is just exploding right now for lots of reasons, not just the pandemic, but for general reasons with baby boomers aging out and just the overall well-being that we're trying to get as folks out here. So skills that you need in a healthcare office setting include very strong communication skills. There's lots of practice in several of the courses in how to communicate with patients, how to handle stressful situations, how to critically think through stressful situations. Also, the medical component, being able to speak the medical language that exists out in the healthcare field, including pharmacology, very common testing that's done, procedures that are done. That's part of this course, accelerated certificate, and a lot of the hardcore electronic health record skills. And I'll let my cohort colleague, Kathy Spahn, speak to those specific skills.
Thanks, Amy. Yes, welcome. I'm very glad to have this opportunity to speak about the program and what we can do for you. We do have a medical administrative procedures course that really hits a lot of those administrative skills, and including that electronic health record that Amy referred to. We work through the entire revenue cycle on the electronic health record, even though many employees don't actually do all of the skills needed within the revenue cycle. We teach them all. So everything from entering patient demographics, scheduling patients for their appointments, working through checking them into their room for their visit, billing patients, entering in insurance payments, and generating statements, talking about collection letters. So we work through that entire revenue cycle on the electronic health record. It is not Epic, and I will say that because Epic has very, due to their proprietary standards, they do not allow education to have any module of their system. So we do the best we can, and we find something that we can do transferable skills. And we've had very good feedback from our graduates that they were well prepared to move into Epic with the electronic health record that we do teach. We also teach, I would say, through the specialized insurance claims class, intermediate coding. Now, they are not ready to take a coding class. They're not ready to be coders, but they do know enough that they can critically look at a claim and determine if it's something that should be paid or why wasn't it paid. So they work through that, as well as different private practice, private insurance, and government programs, learn about the payments and collections. So those are the other things that that our program does teach, as well as those communication skills, as Amy talked about, the terminology, language skills, customer contact skills, keyboarding, some of those technical things, as far as how to work on a computer and critically go through that. So those are the main things of what the program will teach.
And if I could jump back in here and just reinforce something that Kathy, a word she used a couple of times, which was the word critically think. And with all of those hard skills that we're teaching, also the domino effect is learning how to critically think. And because healthcare constantly changes, technology changes, hey, COVID was new to all of us and how to set up protocol procedures. Students need to be able to critically think on the fly, and our program really hones in on that soft skill of critical thinking as well as the other soft skills. But I just want to jump in and just really reinforce what Kathy said about critical thinking. It is critical in healthcare, and we do work really hard on having our students learn how to look at something new and figure out what to do with that.
That's a great point, Amy, and thank you for that, Kathy, as well. To both of you, so you gave us quite a few skill sets and a lot of things that we can expect as far as, what am I going to be tactfully and taskfully doing? As you look at a career path or what jobs, just the question comes up, what positions will I be able to, am I qualified for, or what jobs is this going to prepare me for as I look to say, I want to be in healthcare, where's it going to take me? And that's to both of you.
Sure, yeah, that's great. This certificate, this accelerated certificate, would prepare students to kind of be that frontline administrative person, scheduling appointments maybe, and registering patients. They could also, because of the specialized insurance claims course that's in it, they're also eligible to probably go through like medical billing positions. And it could put them definitely on a path of higher level administrative positions with more training. And we do have a full pathway into our medical administrative specialist associate degree, as well as even an advanced certificate in healthcare management. So we do have definitely a path that these students can, start with this accelerated certificate and move through if they want. But again, I would say the frontline administrative positions there would be very well prepared to jump into.
Great. Sounds like there's quite a few options. And again, this might be the start for some people. And again, you may be established already in the healthcare field. So again, the skills really lend themselves to multiple disciplines. Let's talk more about the actual program and the schedule itself. I'm a participant, I'm a student. What am I getting myself into? How many hours is this going to take me? Self-study time, homework, what's my expectation?
The schedule that's been designed has been laid out so classes kind of begin and a few overlap. What we tell students for each 3-credit course is that they should expect outside of the actual instruction, it's about 6 to 9 hours of additional study time and homework assignments. And it's really important that students spend that time with the work, just because, for example, learning medical language is like learning a foreign language. It truly is like learning Spanish or French or German. So you have to spend the time really honing in outside of the instruction. The schedule is designed so that students are in instruction for about 1.5 hours And they also have support of 1.5 hours I think it's currently laid out Tuesday, Thursday, but don't quote me on that as being the end result of what the schedule will be. But there is direct instructional support designed in here also with a dedicated individual to assist students with questions, with technology, with whatever they may need some assistance with besides the direct instruction from the faculty member delivering the course material and outcomes. So it does take time, and full disclosure, it's rigorous, but if you spend the time each week on the information, you truly will come out with the outcomes that Kathy talked about, the different positions you would definitely be well qualified for.
And if I may jump in here, we have that support programming built in, and that wraparound service built in that you don't typically get in baked right into the program when you join one of our degree programs. It's here at the college that you could always access, but with these particular grant-funded programs, we build it right in as a part of the program that the student, that these are incumbent workers. These are people who have a lot of other things happening in their life. They have a job to go to, they may have family or other obligations. And so it's really important for us to ensure student success by supporting them and understanding that this is a rigorous program, making sure that they know that we're there. You know, we're there, the instructors are there, faculty is there, but we also have the support services there to help. And that really assists them in going through the content, making sure that they are meeting those milestones, that if they have questions, they have an additional person to go to with those questions. So it's really important. We're really excited to have a program that has that baked right into it.
And that's great, which leads into my next question. You know, when all is said and done, you know, and we talk about credentials and where is this taking, what does it result in? Is there some sort of degree? And then after that, let's just say, is there an opportunity to get into some additional degree program?
I can speak to the beginning part of that, and then Amy and Kathy, if you want to speak to the other programs that this would lead into. But this particular program was created based on some of the foundational courses in a variety of degree programs, and you will receive a mini credential or a certificate as you come out of this program. So it does come with a certificate that does then allow you a foundation for additional programs that you could walk into at the college or also if you want to. And Kathy and Amy, if you want to speak to some of the other programs that it might lead into.
Sure. Right. Like you said, all of these courses would ladder right into some of the degree programs that we have within the medical business technology area. So they are the exact same classes that would move right into our diploma program of healthcare receptionist, diploma program of medical billing specialist, and then laddering up. All of those courses move right into and satisfy courses within the medical administrative specialist associate degree program. So it's very attainable for students to move through that ladder. And many times, you know, it's the confidence. Students just need to learn that, hey, I can do this. And they, once they get going on the education train, they just move all the way up, and many of them do decide to move all the way through and get their associate degree, which is great. Beyond that, there is an advanced certificate in healthcare management, and as well as many transfer opportunities to various bachelor degree programs. On the other side, you could take many of these classes and put them towards more of a direct patient care, hands-on type of position, you know, going right into the medical assistant program, which is hands-on. It's different than medical administrative. So these are the people who, you know, room the patients and give vaccinations and take some vital signs. That's medical assistant, not to be confused with medical administrative specialist. So that medical coding, many of our courses go right into that medical coding program. So there are a lot of different paths that students can decide to go after getting the certificate. The classes will satisfy many of the classes within their programs.
The beautiful thing about this is that it's a launching board. It's a place to start, and it's great because you don't have to have any previous background necessarily in the medical world to go into this. So for someone who is at a facility who is working in something that is not necessarily healthcare related, it could be food services or housekeeping, but really likes the idea of moving into a career that is healthcare related, this is a perfect opportunity to take that step in. It's a minimal commitment. I say minimum as far as it's not a 4-year program, right? It's about 6 months. So it gives you a taste, lets you understand what it's about. And at the same time, it offers you the opportunity to move into a position that is a high need, higher pay position. And once you're there, you can then decide, do I want to stay here? Do I want to go back to school and go further with this? So it's a really great opportunity.
And it's nice too, you can see with Amy and Kathy being program directors, and I don't want to age anyone, but for a long time, the programs here at Madison College have been very successful, and these particular skill sets and these programs, especially with this opportunity, lead to a lot of different things that you can actually really go right to within, we'll call it the Madison College family of programming. So I suppose I should ask this question, I'm going to go to school and I'm thinking about this, and I've heard something about subsidizing the cost of this, but what does it really cost to do something like this?
Absolutely. Yeah, absolutely. That's great. So this is a grant funded program. There is a workforce advancement training grant that our colleges can apply for every year. And fortunately, this year we were awarded this grant. We're very excited about it. And it offsets the cost by a little over 50%. So what it would typically cost to go through a program like this, your cost is going to be offset by that grant. So it's a significant savings. And at the end here, I'll give you my contact information if you want to set up an individual meeting to talk a little bit through it. Depending on how many students from your facility are going through the program, it'll define what the cost might be for you. But again, it's about 50% off of what the regular price would be to get these, and their credit bearing classes as well. So that's important to note that these classes are credit bearing. What else can I say to that? That's kind of the main piece about the cost, is that being that the grant is there to fund it, it is a significant savings.
So the logical question after all of this information is, when do I start? And then Kathy and Amy, I'd love for you to have a closing comment, but when is this going to take place and how do I get in?
Absolutely. I'll share. I have one slide for you to kind of give you a visual on that. We're looking to start just after the new year in February. And if I may, I will attempt to share my screen here. All right. Okay. And I hope you can all see that. I'm going to go to slideshow. Can everybody see that? Yeah. Okay. Perfect. So we're looking at a February start date. The program will run from February to November. You can see here I have the classes that will be part of the program. They're credit bearing, and it's broken out, as we had mentioned before. There is some overlap in some of the classes. So some of them start in February, some start in March, and then go on through the summer. And then important to note that the way that it's been structured, as noted before, Tuesdays and Thursdays is what we're looking at right now, at about an hour and a half of instructional time, and then your additional homework time outside of that. But that is an accelerated framework. It is block scheduled to accommodate incumbent worker schedules. And then, of course, we have that support programming built throughout that. That is also in that block schedule to accommodate the incumbent workers.
Sounds great. It feels like there's some flexibility built into that as well, just knowing that this is going over roughly a 9-10 month period of time.
Exactly. I'll stop sharing my screen and then I'll just share at the very end. I'll throw my email up there so if people have questions or want to ask further about this, they can.
Sounds great. This has been extremely helpful. And again, it really highlights the number of opportunities that Madison College has been providing for years. And now we've really wrapped it up into really a grant-funded opportunity that I think is very attractive to a lot of folks. Amy, Kathy, anything you'd like to add? Anything that we should know about Madison College, or just about the programming and what you have seen? What's the good, the bad, and no, there's no bad. What's the good about it?
Well, I'll jump in real quick. I'm kind of circling back to a comment that you made a few minutes ago, Mike. about the path and how many directions you can take. And I'll say that Amy and I are both graduates of the associate degree program that we took and moved through higher education. And definitely the biggest thing is that work experience. I worked at UW Hospital and Clinics for many years. Amy was also within the UW Health System. And so we bring that real world experience to the program, and we've worked with it. And we work as a very close team to make sure that our curriculum is up to date and good for the employers. So it's an exciting career opportunity, and and the other thing is that we've also been teaching online, which right now everybody has to be online for the most part. We've been teaching online for many years, so this is not new to us and the curriculum. And hopefully in a non-COVID world in the future, we will also have on-campus courses again. So, but if anybody has any questions, feel free to reach out. I'm happy to answer with email or anything. So good luck with your decision.
And I just want to tag on to that to hopefully we can welcome some of your incumbent workers to the Madison College student family and faculty family and large family. As Kathy said, we are both graduates when we were 9 from the associate degree program and have worked in various areas of healthcare and do bring that into the experience. We also work very well together on keeping that curriculum up to date, as Kathy said. And just from my personal healthcare background, there's so many avenues, so many directions you can go. And right now, with the way technology is booming and things are coming on the horizon for healthcare that we don't even know about. But we do know that if you love medicine, but you don't want to be hands-on patient care, this is a place for you. And there may be a job that we don't know about yet that you'll start in one position and see that and want to move forward. So it is truly, it's an exciting, interesting field that is ever changing. And if you're looking for something like that, we'd love to welcome you to our family at the college.
Thank you, Amy.
Yeah, great testimonials. And again, healthcare will keep on growing, so there will always be demand. So great to hear that. Shayna, over to you.
Thank you. Yeah, I just wanted to point out that we didn't stress it quite enough in this short conversation. What Kathy had brought up, that this is entirely online. So you can take all these courses remotely. You don't have to come to campus. You don't have to worry about bringing people into your facility, especially right now during the pandemic. But and as had been mentioned, that we have been doing online learning for quite a while. We know what we're doing, and we know it, and we know that it can be challenging for students. So again, that's why that support is built in to help them through that process, because that can be a barrier to entry for people, kind of getting afraid of, oh my gosh, how do I even start? We're there for you. We're going to walk you through this entire process. So you don't have to worry about that. So as we're wrapping up, I'm just going to share the screen with my email. If you have any questions for myself, any of our participants, just shoot me an email and I'll make sure you're in touch with the right person and we'll get you the information you need. So I'll put that up on the screen here. Let's see, did it share? Oh, maybe it didn't. It looks like it went, but there it is. There it is. You can see that. So thank you everyone for coming to our short conversation about our healthcare office certificate. We appreciate you taking the time today, and of course, reach out if you have any questions. Mike, do you have anything to add as we close?
Sounds great. Great opportunity. We look forward to seeing you all.
Thanks everyone. Enjoy the rest of your day.